Medicare Part D Crisis 2026. Why your prescription drug costs are soaring. Imagine waking up one morning to find that your prescription drug costs have skyrocketed, leaving you with a hefty bill that threatens to upend your entire budget. This is the harsh reality that millions of Medicare beneficiaries are facing, and it's a crisis that's been quietly brewing in the shadows. The Medicare Trustees 2025 report may have declared Part D prescription drug coverage to be in satisfactory financial condition, but the truth is that the program is on the brink of disaster. The Centers for Medicare Medicaid Services, CMS, is now taking emergency action to contain the damage, but it may be too little, too late. So, what's behind the sudden surge in costs, and how can you protect yourself from the impending storm? But here's where it gets controversial. The Inflation Reduction Act, which was designed to help seniors by capping out-of-pocket drug spending, has had some unintended consequences that are driving up costs for the vast majority of beneficiaries. The law's 2025 benefit redesign introduced a $2,000 annual out-of-pocket cap, increased government liability for catastrophic coverage, and new pricing pressures on insurers. However, these changes have resulted in higher deductibles, increased coinsurance, and volatile premiums for about 95% of beneficiaries. And this is the part most people miss. The national average monthly bid amount, NAMBA, has soared from $179.45 in 2025 to $239.27, threatening base premiums that are well beyond what beneficiaries might tolerate. To understand why this is happening, let's take a step back and look at how NAMBA works. NAMBA is a figure used by the CMS to help determine the costs and subsidies for Medicare Part D prescription drug plans. In simple terms, it's the average cost that all participating insurance plans estimate it will take to provide basic prescription drug coverage for one person for 1 month. The average is weighted by the number of people enrolled in each plan. Now, you might be wondering how this affects you. The answer is that it's not just about the premiums. It's about the hidden costs that could skyrocket your drug bills. Take, for example, the drug Eliquis, which can cost over $700 a month. If a plan requires 25% coinsurance, that would be about $178 per month, and 33% would run $235, far higher than the typical $47 flat copay charged when Eliquis is classified as a preferred brand. While most plans currently use copays for this drug, retirees need to understand that coinsurance on higher-cost medications can create significant out-of-pocket exposure. So, what can you do to protect yourself? The first step is to review your Annual Notice of Change, ANOC, which plans will mail in September. This document spells out changes to premiums, deductibles, formularies, and pharmacy networks. Even small shifts can have big financial impacts. Next, use the Medicare Plan Finder tool, available at Medicare.gov starting October 1st, to compare total annual costs across plans. Focus on total out-of-pocket cost, not just the monthly premium. And don't be afraid to seek professional guidance if you need help navigating the complex world of Medicare Part D. But here's the thing. Fewer plan options mean less room for error. According to Melinda Cahill, co-founder of 65 Incorporated, we had an average of 22 plan options at the end of 2024. In 2025, there are just 14. This means that you need to be more proactive than ever in reviewing and comparing plans. The good news is that some beneficiaries have saved an average of $8,000 by switching plans, with extreme cases topping $100,000 over time. So don't assume that because your coverage worked for you this year, it will work next year. That's utter nonsense. Instead, take the time to review your options and consider buying your prescriptions off-plan if it makes sense for your budget. And don't forget to factor in the combined cost of Medicare into your budget, including Part B premiums, which are projected to rise sharply in 2026. The bottom line is that Medicare Part D is entering a period of unprecedented volatility, and federal interventions are only temporarily softening the blow. The underlying market is fragile, and the best defense is active shopping during open enrollment. Failure to act could turn 2026 into the most expensive year yet for your prescription drugs. So we want to hear from you. What do you think is the most pressing issue facing Medicare beneficiaries, and how do you think it should be addressed? Share your thoughts in the comments below. Medicare Part D premiums set to rise in 2026. What you need to know. Buckle up for a major shock. Medicare Part D premiums are expected to climb next year, and that could have serious consequences for many beneficiaries. According to the latest preliminary data from the Centers for Medicare Medicaid Services, CMS, the average monthly bid that insurance companies submitted for the 2026 prescription drug plans has surged by 33% from last year. To put it into perspective, the nationwide average bid now stands at $239.27 per month, while the base beneficiary premium, the amount that enrollees pay, has gone up by 6% to $38.99, which is the maximum increase legally permitted. But here's where it gets controversial. The CMS isn't just standing by. They have maintained a voluntary demonstration program, initially launched this year, aimed at stabilizing these rising premiums. In a bid to keep things under control, CMS has been negotiating bid terms aggressively and even rejecting bids that push for significant cost-sharing hikes or reduced benefits. Still, adjustments to the demonstration are on the horizon. Originally designed with a uniform $15 reduction in the base premium, a limit of $35 on year-over-year increases, and tightened risk corridors, the program is set to change next year. The proposed modifications will see the uniform reduction drop to $10, the annual increase limit raised to $50, and the risk corridor restrictions completely removed. This move is described as a step toward returning the program to normal market conditions, though it may spark debate among insurers and beneficiaries alike. For those new to Medicare, it helps to know that beneficiaries can choose between a Medicare Advantage plan that includes prescription drug coverage or a standalone Part D plan to supplement traditional Medicare. Insurers submit bids each summer that estimate the average costs for benefits and administration. CMS uses these bids to compute a nationwide average, which in turn influences both the base premium that plan members pay and the direct subsidy provided to the plans. Notably, this subsidy is set to increase from $142.67 this year to $200.28 in 2026, bridging the gap between the established benchmark and the beneficiary's payment, adding another layer of complexity. The data comes at Medicare premiums to skyrocket in 2026. What you need to know. Get ready for a financial gut punch in 2026. If you're on or nearing Medicare, a recent government report is forecasting a significant spike in your healthcare costs, potentially delivering the biggest hit to your budget in 4 years. According to the newly released 2025 Social Security and Medicare Trustees Report, older Americans need to start planning now for some substantial price hikes. Let's break down what's coming and what you can do about it. The biggest Part B premium hike in recent memory. First, let's talk about Medicare Part B. This is the core of your medical coverage, handling everything from doctor's appointments and outpatient procedures to essential medical supplies and some home health services. For 2026, officials are projecting the standard monthly premium to climb by a staggering 11.6%. This translates to an increase from the 2025 rate of $185 to a new high of $206.50 per month. In pure dollar terms, this is the most significant single-year increase beneficiaries have faced since 2022. And this is the part most people miss. It's not just the premium. The annual deductible for Part B, the amount you have to pay out of pocket before your coverage kicks in, is also set to rise sharply. It's projected to increase by 11.2%, going from $257 in 2025 to $288 in 2026. A mixed bag for prescription drug costs, Part D. Now for your prescription drug coverage, or Part D. There's a bit of a silver lining here. thanks to the Inflation Reduction.